December the 20th, 2013, Miami, Florida. A federal judge sentences a woman to 9 years in prison. Her name is Carmen Gonzalez. She had worked as an unlicensed nurse at St. Jude Rehabilitation Center, a Miami clinic that prosecutors described as fraudulent. The clinic specialized in HIV infusion treatments, but according to federal prosecutors, the treatments were part of a much larger scheme. Medicare was billed for services that investigators said were fraudulent. The total reached more than $11 million in fraudulent claims. Gonzalez was not the person prosecutors identified as controlling the clinic. St. Jude was controlled by her cousins, Jose, Carlos, and Luis Benitez, known as the Benitez brothers. Gonzalez worked inside the operation. The clinic submitted claims to Medicare for HIV infusion treatments. Federal investigators eventually built a case around the billing. The investigation did not end with the clinic. Gonzalez had already faced charges in 2008, then she fled. For years, she remained outside the reach of the court. In 2013, authorities captured her. The case finally reached its conclusion. On December the 20th, Gonzalez was sentenced to 108 months in federal prison. That was 9 years. The government said the scheme had generated more than $11 million in fraudulent Medicare claims. The money had moved through a system designed to look like legitimate medical treatment, but investigators found something different. The records became evidence, the clinic became evidence, and the people connected to it became defendants. The case was one part of a much larger Medicare fraud problem. In 2013, the Medicare Fraud Strike Force charged 89 people in one nationwide takedown involving approximately $223 million in alleged false billing. That same year, federal authorities were pursuing hundreds of cases across the country. For Gonzalez, the investigation ended with a federal sentence. The clinic was gone, the billing records remained, and $11 million had become evidence.